So with OSGOOD-SCHLATTER, you have knee pain. You wake up, you still have it, but you have a game that day and then you play through it. And then that just makes the pain get worse and worse because you're never allowing your body to recover.
Nicole, welcome to the Strong Female Athlete podcast.
Thanks, Erica. I'm excited to be on.
Yeah, happy to have you here. And it's been really awesome to just see your journey in professional sports and back to the youth space and just all the great work you're doing from a physical therapy and performance standpoint. And I think you're the perfect person today to talk about Osgood-Schlatter in youth female athletes because sadly it is very common and I get a lot of questions and concerns from parents that their daughter's in a lot of pain, but sometimes they're still pushing through. It's just really not going to end well. So we're going to talk about a lot of solutions and just some things that youth female athletes can do when they get knee pain as they're going through growth. But maybe just talk about what you're up to today in the youth space and why you're working with the youth athletes of today.
Yeah, so I work for Phoenix Children's Sports Medicine. And so we have a couple of clinics around the Phoenix, Arizona area and see mostly youth, middle school, high school, and some college athletes. And I wanted to get into youth sports. I'd done a couple years at the professional level. And while I loved it, it was great. I love that population. I started noticing that a lot of the athletes, they carried injuries from when they were in high school or middle school, and still some of the, longer term effects of those, or training age can be kind of low in professional female sports. I think that's starting to change, but certainly when I started in pro women's soccer, sometimes some of the athletes had a low training age, and which means that basically they hadn't really been training for as long at a high level as what you would see in men's professional sport. Some of them who had been to, great, well-resourced college athletic programs did have that from at least the time they were in college. Most of them never lifted in high school, certainly not any younger than that. And so it was really trying to develop them as athletes on top of allowing them to perform at their best as professionals. And so I started thinking, I really wish someone had, gotten a hold of these athletes at a younger age. And so when my husband and I decided to move to Phoenix and buy a home and put down roots and settle down, I knew that kind of being in the youth space was going to be a great thing for me to feel like I was making more of an impact. And so now I work with a lot of middle school and high school female soccer players. That's a huge part of our population that we see. And yeah, I'm just really enjoying giving them kind of high level care that I wish the professional athletes had gotten when they were this age.
Awesome. Yeah, that's so brilliant. And I really want to encourage the parents listening to take notes on this conversation because this topic around Osgood-Schlatter is something that many are going through and their girls are really struggling with knee pain. And maybe we can just start off with what is Osgood-Schlatter and what causes it?
Yeah, great question. So it's when the child or the athlete is still growing. And so there's open growth plates while our skeleton matures and grows. And one of the areas where there's an open growth plate is at what's called the tibial tubercle, or it's right on that kind of bump on the front of the shin, just below the knee. And that is still open in kids. And so what happens is when kids grow, when humans grow, our bones grow faster and they grow first. So bones start growing. And then you can imagine that the muscles that attach to those bones get kind of put on stretch because the muscles don't elongate at the same rate that the bones do. So bones are growing and stretching. The muscles that attach to them then get put on stretch. So then the areas where those muscles attach to the bones get put under a high rate of stress and strain. And so the quad muscle, as an example, goes down and it becomes the quad tendon, and then it's your patella or your kneecap, and then the patella tendon just below your kneecap, and that attaches to that tibial tubercle. So as the femur, your thigh bone, the tibia, your shin bone, as they're both growing and elongating, those areas where the muscle and tendon attach to the bone get put under a high amount of stress. And so the patella tendon attaches to that tibial tubercle and starts to actually pull away a little bit from that tibial tubercle. And because there's an open growth plate there, that's what kind of makes this possible. And so you can imagine tendon attaching on top of the bone, starting to pull away from that bone a little bit. And the bone responds by laying down more bone tissue. And that's how that little bump forms. That is the hallmark sign of someone who's had Osgood-Schlatter's. You can take any adult, and if you feel for that bump on the top of their shin, you can say, oh, you had Osgood-Schlatter as a kid, huh? And so that bump remains long after any symptoms are present. And so that is just the result again of patella tendon pulling away a little bit because it's under so much strain, because the quad is being put on stretch, because the bones are growing. More bone tissue is laid down. The issue is that that process of pulling away, creating some strain, and then laying down more bone tissue, that can be quite painful. And that's what athletes are experiencing when they're having this pain at that tibial tubercle from Osgood-Schlatter's.
As you were describing it there, I was just like, ooh, like couldn't help but cringe. I'm like, that sounds painful when you put it into words. But yeah, I have heard from a lot of youth female athletes, it can start off as kind of a dull pain and then combine their growth with all of the training they're doing, skill sessions, practicing 3 to 4 times a week, then it can be a recipe for disaster. So I guess when should they take that pain seriously and start to do some physical therapy to work around this?
Yeah, so with Osgood-Schlatter, it's kind of like anything else in terms of if you're experiencing a level of pain that is tolerable, because certainly, pain to some extent is a part of sport, it's a part of being human. It's often helpful to have pain. If you lived a life with no pain, you would be in quite a bit of trouble because you would never know if something was worth your attention or not. And that's what the whole purpose of pain is to draw your attention to something. And so what ends up happening is if you're experiencing pain that is tolerable and comfortable and you can deal with it, and let's say you're playing in a soccer game and by the end of it, you're having some achiness and some soreness in that area. But by the time you wake up the next day, it goes away. That's okay. That's a normal cycle of putting some strain through a tissue in your body, and then it recovers and adapts, and then you're back to baseline. That should be a normal cycle. What often happens is then we get to the point where we're doing a little too much and we're doing just a little bit more than what we can then recover from. And just like anything else, this happens after a weightlifting session, after a practice, after a game. Our body always needs time to recover from whatever load we've just exposed it to, or whatever demands we've just placed on it. And the recovery process is when the body then adapts. And adaptation is always what we're after. So if you think about a strength training session where you're lifting weights, what happens is you're actually creating little micro tears in your muscle that creates a response that your body says, oh, we have to adapt to this. And so then while you recover over, 24, 48, 72 hours, if it was a really intense session, or a game, 72 hours, as you recover, your body is laying down more of that tissue, more muscle, more bone, whatever it might be, to make up for that micro damage that we're causing with training, that we're intentionally causing with training, because then that's what makes us stronger and more resilient. That is a normal cycle. That becomes problematic when we don't give the body enough time to recover and create those adaptations. So with Osgood-Schlatter, You're training, you have knee pain, you wake up, you still have it, but you have a game that day and then you play through it. And then that just makes the pain get worse and worse because you're never allowing your body to recover. And so the crucial thing, which most people don't want to hear, is that unfortunately, what you need is some downtime when this is happening. When it's in that acute phase of pulling away from the bone, laying down more bone tissue, and there's inflammation in the area. Sometimes it can even get red or warm to touch. When it's really painful in those acute stages, that's the time that you kind of really just need to rest and let it recover and adapt. So that's step one is when it's really painful in that acute phase, allow yourself to recover and adapt. Now, if you go and you're having no pain and you go and do a training session and you still have no pain, that's great. You don't have to change anything. You can still train and be fine. If you wake up the next morning and you still feel fine, good, go ahead and train again or have your game. It's when you don't return to that baseline or when you wake up the next day or you go to start training again, because often you can wake up and feel okay, but then you start jogging during warm up and you're like, oh, yeah, I feel it. And so that's the time where you need to be like, you know what? I'm still feeling this knee pain from yesterday. Maybe you can try to work through warm-ups and see if there is a warm-up effect. That's why we do warm-ups. That maybe it starts to feel a little bit better and then it's okay. But the second it gets out of what I tell patients, that tolerable pain range, and what I mean by that is you can, describe it a number of different ways, but basically you could say a 3 or 4 out of 10 on that 0 to 10 pain scale. Or you can say the moment when you're thinking about your knees more than what's going on in the game or practice, or whenever you're like, you know what, I just don't want to continue having this pain. I'm thinking about this way too much. It's to the point that it's not something I can tolerate anymore. When it gets there, that's when you really need to take a rest and be like, okay, I know that if I don't rest now, it's just going to get worse and worse. And now it's going to take me 2 or 3 days to have that recovery response instead of only the one day that it might if I keep it comfortable and tolerable. So that's really the balance that athletes and parents and coaches need to strike is, okay, this is comfortable. This is a tolerable level of pain. Maybe it's okay to play during this. But then the next day, it's a little bit worse when you start to run again. Okay, now you need to take a rest.
I really like the emphasis on recovery and taking some off days because I think sometimes they'll work with the physical therapist and think that the exercises that they're doing in the clinic are going to solve everything, but at the same time, they're still plowing through 6 to 7 days a week and they're like, why am I not getting better? So it sounds with Osgood-Schlatter, it is this holistic approach, cutting back on load combined with maybe some strength and mobility training. So maybe we can talk about the strength and mobility side of things for this age group of female athletes.
Yeah, absolutely. And so what we focus on in physical therapy then is trying to stretch, right? Because, like I said, the bones are growing, the muscles are having a hard time keeping up with that rate of elongation. And so they're put under stretch. So they're put under tension, which means that they're tight. And so stretching can be helpful, stretching the quads and the hamstrings, especially, because those are the muscles that attach, around the knee. And so stretching is an important part of that. And then the strengthening is really important because what we're after with the strengthening component is increasing your tissue's ability to tolerate increased load. And so while you're taking this little, this rest, like you said, it's a holistic approach. You can't just load is load, right? So you can't be doing strengthening exercises in physical therapy and then going to soccer right after and then having a game the next day. And then you also run cross country. And so you're doing that. That's just increasing load, which is actually not going to help at all. It might even make it worse. So you do need to cut back on what you're doing outside of physical therapy, all of those aggravating factors, which are mostly going to be running, jumping, cutting. So anything involving those activities, cut down a little bit on keeping it tolerable. And so then in physical therapy, we're trying to strengthen the muscles around the knee so that your quad can tolerate more load. Your patella and quad tendons can tolerate more load being put through them without this increase in pain. And so what we're looking for is, okay, how much force can you produce through your quads and hamstrings? On day one, I measure that in the clinic. And then how did that feel? Was that, a 3 or 4 out of 10 pain? That's what we want to keep it at. Okay, good. Now let's say 3 weeks later, you're still having that 3 to 4 out of 10 pain, but you're producing more force. That's a victory, right? That's a win because you're able to tolerate more load through those structures in your body without increasing pain. And so that's a good thing. That's one of the things that we're after in physical therapy. So the main goals of physical therapy then are to some extent providing relief, but really the pain relief is going to come from not overdoing it and allowing yourself to recover. And the objectives of physical therapy are, can we improve the amount of loading that your body can tolerate before it brings on these symptoms?
Now, what's a good frequency for someone with Osgood-Schlatter's to do the strength training with a physical therapist or strength coach while also cutting down the sport load?
Yeah, I am a big fan of always, if you can do twice a week, and it really kind of depends. If you're a youth athlete who has a strength and conditioning coach, does strength and conditioning sessions regularly, and you have been doing that for a little while, then maybe you're gonna need or better able to tolerate 3 times a week of strength training. If you're a novice athlete in that you haven't really strength trained before, or you don't have a strength and conditioning coach, it's not really something that you've been exposed to, then twice a week is a good frequency. And the reason for that is that, again, we're trying not to overdo it. Your body's not used to it. It's a new stimulus for your body. So, one, you're going to get the adaptations a little bit faster than someone who's been training for a while. So, you don't need quite as much frequency. And on the other hand, or in addition to that, your body's not used to it. And so doing it 3 times a week might just be a little bit more than what it can realistically recover from initially. So I would always start with, around twice a week if they're still doing their sport. If they're not doing their sport, then maybe we can go to a third day a week and work on something in addition to that, like conditioning, making sure they stay conditioned for their sport. Working on other things as well, right? Like I think it's part of a holistic strength and conditioning program. And I kind of always say rehab is just the one end of the continuum or one end of the spectrum in performance. And so rehab at some point should start to look like a strength and conditioning session, just bearing in mind the specific adaptations we need to go after for that injury. And so this is no different. So maybe we start a holistic strength and conditioning program twice a week while they're with their team, maybe twice a week. The one thing I always say is try to always have 24 hours of recovery in between at least. But if you have a game, you're going to need more because game demands are higher than practice or strength and conditioning sessions or PT sessions. So if you have a game, try to have at least 2 days of recovery where you're literally just doing that, recovering, maybe doing some stretching, or you could do some light isometrics. And so isometrics are a type of exercise that we'll do in physical therapy, and they're low load enough that you can do them on your kind of recovery and rest days. You can do them on back-to-back days, and it's not necessarily going to flare things up. And so an isometric is just when you're contracting muscles, but there's no movement occurring. And so if you imagine um, pushing like against a wall that's not going to move, you're doing an isometric contraction because you're using muscle force, but nothing is moving. You're staying in the same position. And so how you do that for the quads and the hamstrings is you can do a hamstring bridge where you have your heels up on, like you're laying on your back, have your heels up on a chair or your bed or couch or something, and you're digging your heels down into whatever object you have them placed on, and you can feel your hamstrings working, but they're not moving. They're staying in the same position. For the quads, it would be if, it's easy to use a leg extension machine. But if you don't have access to that, you can just, be sitting in a chair and maybe put one leg in front of the other and then have your back leg kick out against your front leg, as hard as you're able to. And that's an isometric contraction for your quad. You can also do wall sits. I think a lot of people know what a wall sit is, and that's a pretty basic thing that you can do at home. And so isometric exercises and stretching you can do on your off days or recovery days. And those are still ways of helping increase your load tolerance without necessarily overloading the structures.
Mhm. Now, how long does it take on average to really mitigate the pain if they do all these things, cut back on sport load and strength train at a minimum 2 times a week? Is it like a couple weeks, a month? Like, how long should they expect?
Yeah, it's highly dependent on what stage they're in. And so if this has been going on for quite some time and you're just now addressing it, expect that it's going to take quite some time to start to feel better. You may start to feel better within, 2 to 4 weeks. You may start to feel, oh, hey, I can get through my day, go up and down the stairs at school without having knee pain, or I can, because sometimes even just sitting for a long period of time can cause some of those symptoms too. Or I can sit through a day at school and it doesn't hurt. And so you'll start to notice these things that are feeling better within just a couple of weeks. And that's always the dangerous zone because that's when kids start to feel like, hey, I'm feeling better. I can go back and do everything again. And that's not the case because just like we're, taking away some load, you can't then just go back full throttle to what you're doing before. It does need a gradual ramp up period, which your physical therapist or strength and conditioning coach can help guide you through. And so if you're doing, two strength training sessions a week and one soccer practice and one soccer game a week, and you're starting to feel better, you can't then be like, okay, I'm done with physical therapy. And now I'm just going to go back to having two cross country practices a week, two soccer practices a week, a softball game and a soccer game each weekend. That's where we get into trouble and we get into what is called like a boom bust cycle, where it's you go through a period of not having any pain during your day or having, tolerable pain. So you say, okay, I can go back to doing everything. You go back to all of the things, you have your pain again. And so now you take time off again. You start to feel good. You go back and now you're having pain again. And that actually ends up deconditioning you more than if you just took the necessary time from the beginning to allow your body to recover and then gradually ramp up your level of activity again.
I'm so glad you brought this up, Nicole, because I get this question a lot from parents. They're like, well, we did everything. We cut back on load the whole summer. We did our strength training with a PT. And then come August, when season started, her knee pain's back again. And I'm like, well, did she jump right into the full game? And they're like, yeah, we did. And I think this is so important to discuss because, yes, strength training helps with injury reduction, but we don't talk about mismanaged load enough. And coming back from rehab for Osgood-Schlatter, it needs to be gradual, like you said. And maybe you can explain why, just like the science of that and what happens to the knee and the muscles when you all of a sudden spike that load from taking time off from your sport.
Yeah, absolutely. And so the reason that we need to have this gradual ramp up period is because I guess let me start with a bit of an analogy. And so when you are training for a marathon, you gradually increase your mileage, right? So right now, I'm not training for a marathon. I did one years ago and will not train for another one, mostly because of the time involved in training. But so I run, 2 to 3 times a week, maybe about 3-ish miles. Now, I can run. I have no pain while running. I'm able to run 3 miles pretty easily. I have no pain in my body at all. That doesn't mean I can go do a marathon next week, right? And so if I went to go do a marathon next week, despite the fact that I run twice a week without pain, I would be in considerable pain for quite some time after that marathon. I don't even know if I could finish one. And so the reason for that is that I have not created enough of a stimulus in my body over time that my tissues are and my body in general was able to do that. It's not trained for that. And it's the same thing if, I hear this too, oh, that we took the whole summer off, but then when they started soccer again in the fall, they had pain. Well, yeah, t great that you took the whole summer off. And also, in taking the summer off, you've deconditioned your body. You have made it so that your body cannot go and do a whole soccer game right now because you've not done it in 2 or 3 months. And so that's kind of the whole point of strength and conditioning or physical therapy and training. That's the whole point of preseason, really. That's why college and professional teams have preseason is so that you can gradually increase your exposure to load so that you can go and compete in a 90-minute game, no problem. But until you've done that, you've not really earned the right to play as much as you are. You have to earn the right to play a 90-minute soccer game. You have to earn the right to play a tournament where you're playing multiple games in a weekend. You have to earn the right to go back to training 3 times a week or more. And you can't just go from not doing that to doing it and expecting that nothing's going to happen. Maybe you'll be lucky and nothing will. Sometimes kids are super resilient anyway, and it's fine. But especially these kids going through growth spurts, that's when the risk of Osgood-Schlatter's or even other, growing related injuries like severs
Mhm.
can happen is when you just have a huge jump in the amount of load because again, you just haven't given your muscles and tendons and bones the proper training to be able to do that. And we shouldn't think that our bodies are just baseline ready to do that in the same way that nobody's body is baseline ready to go run a marathon, right? Like you have to earn the right to do that. And so that's the importance of that. You just haven't like created the tolerance to it.
I think it's important to touch on what you were saying about taking the full summer off. Yes, we encourage female athletes to take off from organized sports like team practices and games. That should be a downtime for most people, but that doesn't mean plop on a couch and do nothing.
Mhm.
It could mean just getting a different stimulus or variety of movement that doesn't cause more pain to the knee. So maybe just linear running for a couple weeks and then slowly ramp up, like Nicole said. But you have to work with a PT or a strength coach and have a professional who is monitoring this. While I would love to give a program and like 5 exercises you can do on this podcast, it's going to be very unique for everyone. So I really encourage you to find someone to work with.
Yeah, absolutely. Because again, just that sudden ramp up and like you said, like I encourage people to take the summers off or around the holidays off, go on family vacations, have fun outside with your friends. Like I said, if your off time, which I'm seeing more and more now, means that you're watching YouTube videos or TikToks or just sitting on playing video games all day long and not having any movement or activity, like you're not then ready to go and have activity. You have to prepare your bodies for that.
And I'll recommend you all watch this YouTube video of our podcast while doing pull-ups or some sort of like exercise. That usually tends to work. But
Yes.
yeah, if you're doing that all day and not moving and strengthening the whole body, then that's when it becomes a problem. Now, I know a lot of sports parents listening, like they don't want to hear, oh, like we have to take time off. What do you mean? Like we have a very important season, there's a tournament coming up. But my argument's like, well, usually girls with OSGOOD-SCHLATTER are like 11 to 13 years old. We are not in prime recruiting and showcase years. So let's wait. And I guess my question to you is, what are the long-term repercussions if they don't take care of something like this during growth spurts?
Yeah, so I think the biggest risk is dropping out. If you're just miserable in pain, month after month and you're not taking care of it appropriately. And like you said, this happens 11 to 13-year-olds. Like, no, but I don't care how good you are at that age. Nobody is elite at that age. Like, nobody is, you know, getting college scholarship offers at the age of 11. That's not happening. And so that is the time to really allow yourself to recover. And I mean, the good news in all of this is that with Osgood-Schlatter, once the growth plates close, it's no longer an issue, you know. But while they're still open and this is still happening, you still have the propensity for this pain to be occurring and for you to be experiencing this. And again, just for optimism and something I tell parents is by the time they're of the age where they will be starting to get recruited or they'll be competing at a really high level or signing with a pro team, this will no longer be an issue, right? Because the growth plates will be closed and it'll be fine and you'll be good. So the big risk here is, are you taking away so much time of them training and developing their skill and developing their athletic capabilities during this time period because of pain, that if you just took care of it right away and it's resolved in a couple of months, that is far less cumulative time away from sport than if you don't take care of it and now it's 2 years and they're still, having to miss games and practices because of pain. And so the big risk there is two biggest risks, I think, are one, kids drop out. We already know that especially young girls around the age of the onset of puberty drop out of sport. And so that to me is the biggest risk factor. I don't want kids dropping out of sport. Sport is so important for a healthy and active life. It's good for social life as well and just psychological well-being, especially girls at this age. So if you add pain on top of like unrelenting pain for months on end to this already inherent risk of dropping out of sport, it's just, I just see girls dropping out at high rates because of that. So that's the one big risk. The second big risk is, again, this is a prime age for developing skill and athletic capability. Developing this is what I said earlier on, why I like working with youth athletes is because this is a great age to develop that so that they have the potential to be a, great college or professional athlete down the road. So missing on that time and you'll miss more of that time by not taking care of it immediately. And then the third risk is just other injuries in general. If you are going out there playing and you are having pain, your body is going to, on a subconscious level, make you move differently. So now, if you're avoiding loading the front of your knees because it hurts, and again, this isn't a conscious thing that we choose to do, the brain does this without us even realizing it. So you're moving differently. Well, maybe now you're going to sprain your ankle more often, or maybe now you're going to be overloading your hips and start having hip pain and develop issues there. And so that's another risk involved in this is that you're playing through pain, moving differently now, and then other things can potentially come up because now you're loading those things differently than what they're used to.
No, I have a question about knee braces. I see a lot of girls when I go watch tournament games wearing knee braces because of Osgood Schlatter. And I just am curious your opinion on it. Does it make them subconsciously move differently or be hesitant because they have the brace on? Is the knee brace even helping during something like this? What are your recommendations?
Yeah, my general thoughts on braces across the board are they're largely not doing what we think they're doing, right? So if we think, like, I've heard every reasoning under the sun for wearing a brace in terms of like, oh, it's keeping the patella or your kneecap in, you know, in proper alignment and tracking the right way. And like the truth of the matter is, no, it's not. And so outside of that reason, like outside of a purely biomechanical reason, because it's not quite doing that, if your kneecap's moving around, it's going to move around, and that's fine. Um, then we can say, okay, it's these non-specific effects, which, maybe is a bit placebo, and that's fine. I have nothing against placebo, right? Like if it's making you feel better while playing, sure, go for it. Like that's kind of my general approach is if this makes you feel better, go ahead. It's not going to do harm. It's not going to do what you have probably been told it's doing, but if it feels good, sure. However, if it's making you more conscious of it, if you're fiddling around with it and playing with it during the game instead of just focusing on playing, then maybe it's doing more harm than it's worth. So if it's not helping, or if it's making you think about your knee even more, then there's no reason to use it. If, however, you put it on and you're like, oh, that feels good. Because sometimes, like, even some of just like those neoprene sleeves just feel like a little hug around your knee and it can feel nice. And so, sure, if that's helping you and you feel good wearing that, then go for it. Just understand that it's not doing what they claim to do in terms of keeping your kneecap in alignment or whatever bogus claims they make.
Any final words for the sports parents listening if their daughter is going through Osgood-Schlatter, or maybe the coach is listening and one of their players comes up to them and says, "Hey, coach, I have some knee pain." Any final words for them?
Yeah, my overall advice would be that this is a growth and loading issue. And so the growth thing we can't help. It's going to happen. It should be happening. We want them to grow, of course. And so understand the light at the end of the tunnel is there, and that once they are done going through this growth spurt, this pain will resolve. They will be okay eventually. Um, and then I would say, in terms of the loading side of things, that if a kid is coming to you just ever, period, no matter what, and saying that they're in so much pain and discomfort that, they don't feel like they can keep playing, then like don't force them to. That's just like, I feel like that's just cruel. Like, a poor kid coming to you and saying something hurts. They're not making it up. It is real. And even though there was no like specific trauma or injury, that doesn't mean that what they're experiencing isn't real, because it very much is. And so just kind of understanding and having some empathy for them in that, they don't want to, most of the time, they don't want to not be playing. So if they're complaining of pain, I would, take it seriously and understand that you have plenty of time in the future to be competing and training. Take the time right now to let this resolve, and you'll end up saving yourself. What's that like? Oh, I feel like my like grandmother used to say this, like a stitch in time saves nine. Like take care of it now, and then you don't have to keep taking care of it for months on end. So I would say listen to them when they tell you it hurts. Hopefully, there's a relationship there between coach and player and parent and player, that the kids trust you, that if they tell you they're having pain, you're going to take it seriously and not just dismiss it, and also not overreact. It's kind of a tough balance there. I understand that. So if they're telling you something hurts, believe them, have empathy, and give them that time to rest. And then likewise, if they tell you the next day that they're feeling better, they weren't making it up the day before. Their body has just recovered and adapted. And so if they're feeling comfortable playing and training, you can allow that. But if it gets too uncomfortable, too intolerable, listen to them, let them rest.
Awesome. Well, this was really helpful for the parents and coaches listening. So I hope everyone enjoyed this episode. I will leave Nicole's links and information in the caption below. So please give her a follow. She has just so much great content out there, and she's willing to talk and answer your questions and work with you as well if you need extra help. So thank you again for listening, and I will see everyone on the next episode.